Today is February 17th, 2021. I'm Trey Dobson, the Chief Medical Officer at Southwestern Vermont Medical Center and an emergency physician with Dartmouth Hitchcock Health. And this is Medical Matters Weekly, the show about the aspects of healthcare that matter to you most. You can submit your questions on Facebook Live, as always, and we have some questions that were submitted ahead of time at wellness at svhealthcare.org. You can go to our website and submit those ahead of time. The title of our show today is So Many Choices, So Little Time. And my guest is Dr. Marie George, infectious disease physician. Welcome, Marie.
Thank you, Trey. It's nice to be here.
I am so excited to have you. Dr. George attended medical school at Georgetown University, internal medicine residency at St. Elizabeth's Medical Center in Massachusetts, and fellowship in infectious disease at Tufts University Medical Center. Marie, I have worked with you for 15 years, and I'm so happy to learn a little bit more about you personally. Of course, we know a lot about each other, but this is a time. Did you know that the first patient I took care of in July of 2005 was an infectious disease patient, and I had to consult you. It was a Mulleray's meningitis. I don't know if you remember that. It was fantastic. So to start off with, just tell us a little bit about where you grew up and how you became interested in medicine.
Okay, well, I grew up in the Berkshires, so officially I am a first cousin of Vermonters and have been a Vermonter now for 22 years. I grew up in Pittsfield, Mass, and attended Taconic High School for those, Taconic Braves and others. I became interested in medicine, I guess, actually in college, most interested. I was a physical therapy major and actually completed my physical therapy. That's a small known fact, I guess. But when I actually, wherever I've worked, I have a great connection with physical therapy and practitioners of PT. Actually even did some respiratory chest PT on a patient just the other day.
Wow, great.
But I think halfway through college, I decided to pursue medicine and was able to do that.
That's great. So we talked about your training. What does an infectious disease doctor do? How would you describe that to the public?
So up until this pandemic, I think infectious disease doctors were somewhat obscure in the medical world, and people were afraid of putting the sign infectious disease on their door. But in fact, ID doctors do a very important role in institutions of many kinds, particularly hospitals. We are the specialists that are the most that study antibiotic use and the pathophysiology of both bacterial infections, viral infections, parasitic infections, and other unusual infections. We are the folks that take care of chronic diseases such as HIV infection. We're the ones that are mostly in charge of infection prevention in a facility. And we are the ones that are always talking about judicious antibiotic use and stewardship, so that we can maintain the effectiveness of our antibiotics in this world where bacteria and others are trying to become resistant. That's part of our role. I guess I could go on for a long time, but Dr. Fauci has put a face to who we are. And there's many ID people do research and are both are researchers and clinicians. So if young people are interested in the most interesting part of medicine, infectious disease is it.
Well, that's great. It's a great explanation. I can say it's one of the many benefits of practicing for me personally at Southwestern Vermont Medical Center is your presence. Having an infectious disease doctor as an emergency physician really helps me take care of my patients. And through your work, Dr. George has an outpatient practice, and then she, of course, is inpatient, and she is on call 24/7, basically, which is amazing. And I also know that the whole medical staff appreciates your presence, but so does the community. And I'll say, as a community member, you may not remember, but my family came to you 4 or 5 years ago when we were traveling abroad to get our travel vaccines. So that is the many benefits of having an infectious disease physician and team, because you have several colleagues and nursing colleagues that you work with.
I certainly remember that, I have to say, because the video that I got while you were in India of the snake charmer,
that's
the
right.
snake that came out of the basket while your children were watching was fascinating.
Yes, we did not get any antivenom prescribed, but we did get all our vaccines, so that was great. Well, and then one last little personal question. What do you do personally outside of medicine, especially to cope with the current stress, but also what are your personal interests?
Well, like many Vermonters, I guess being out of doors is the best for de-stressing. And I'm a kind of a four-season enjoyer of the Vermont landscape and all of our opportunities to be out of doors. I especially like winter, much to my mother's chagrin. I rave about how cold it is outside. But I think that for all of us, we've been very lucky, even during this pandemic, to be able to enjoy outdoor activities like cross-country skiing. And I've taken up paddle, tennis, and I also bike and hike, and like many of us do. A shout out to my book club, who we enjoy reading, and they are wonderful supports.
Oh, that's great. Especially during the time of this pandemic, it's good to decompress, get away from work some. So the title of our show, as we talked about earlier, is So Many Choices, So Little Time. And by that, we're talking about vaccines, if you couldn't guess, based on our guest today, Dr. Marie George, infectious disease. Why don't we start off with the fact that we have Moderna and Pfizer. We're on vaccine day about 60-something. Here locally in Bennington, we're vaccinating up at Southern Vermont College, several hundred per day. There are vaccine clinics all over the region, including at Burr and Burton Academy, Weston Theater, and some other locations that are popping up. So we have other vaccines, though, Marie, that we are reading about. So can you talk a little bit about perhaps Johnson & Johnson and some of the other vaccines?
Yeah, it is exciting. And as an ID person, I should have said that, it is one of the great accomplishments of humanity is vaccine research and success. And all of these vaccines that we are using have a basis that historically and vaccine development has been going on the same way for literally hundreds of years. So people should not feel that these vaccines are something completely new. The Johnson & Johnson vaccine, in fact, has been a tried and true kind of a vaccinology technique where we use a virus that is inactivated to help fool a cell into getting the novel vaccine into the cells that are going to create antibodies. We use this inactivated adenovirus. It's a fascinating but well-tried and true kind of a vaccine technique. It has appeared to work very well. There will be great, I think, success in using this vaccine, and it has some advantages. It is a single dose vaccine at this time. It is one that could be boosted later. It has been used in many people experimentally with great safety, and it is a vaccine that is easier to store and easier to produce in large numbers. And there's a very admirable amount of immunity that is generated from this vaccine. And like the earlier vaccines, the Moderna and Pfizer, it has been very successful in eliminating serious infection, even symptomatic infection, and probably will decrease and will definitely decrease spread from the vaccinated person to anybody else. So all of the goals that we need for all vaccines are achieved by the candidate vaccines that we've seen so far.
Oh, that's great. So we have these 3 vaccines, and then potentially even more, right, coming about late spring and in the summertime.
Right. The Novavax vaccine is another vaccine that will be that has a similar but different kind of a matrix, a protein matrix that again is injected. It brings the vaccine that we want to be used in the nuclear part of the cell and to be and to stimulate immunity. It actually is it helps the cells identify and bring that our novel vaccine into the cell, into the DNA, matrix M, sorry. And it is it's another vaccine that appears to be very effective. It will almost certainly achieve exactly what we wanted to achieve, which is to make any infection that is acquired by the person that's vaccinated not have symptoms and certainly not be seriously ill or die. And that is the ultimate goal of vaccines.
That's right. That's great. So for the audience here, if you have questions, please go ahead and submit those on Facebook Live. And Marie is talking about the fact that in all of these vaccine trials, there were 0 deaths from COVID-19 and 0 hospitalizations for severe illness. And in that regard, the vaccines are very similar at protecting the public, and in fact need to be done right away. So what would you say to someone who wants to hold out for a particular type of vaccine?
Well, there really is really no reason to do that. We have a variety of different technologies, but these vaccines are all achieving the same end. And the more people we get vaccinated, the greater benefit we get across our whole population, and the sooner we get back to normal.
And that's right. That's exactly. So Marie and I talk a lot about these words of efficacy and effectiveness. Efficacy, means how well did the vaccine perform in a trial, and then effectiveness is how does it perform after the trial is over and out in the public. And one of the confounding factors here is these vaccines have been released at different times during their trial period, and so the variants that we hear about may or may have not been present for some of them. But the important point is not as much that efficacy number, but what Marie is talking about is that it prevents severe disease, prevents death. Having a sore throat for a day because of you're vaccinated and you get a sore throat for a day, that's fine, basically. What we don't want to have are severe illnesses that we've been seeing. Marie, I've been talking to a lot of people, and over the past week around the country, actually, so not as much in Vermont, but I'm starting to hear from a lot of 20 and 30-year-olds. These are relatives of mine and friends who are saying, gee, I'm glad the vaccination's going so well for the older population. So now I really don't think I need to be vaccinated. Isn't that right? I mean, my age group's not having problems. So good for the older folks, and I'll be okay. What would you say to that?
Yeah, well, it is a flawed approach because the virus will continue to circulate and be present in our community if we have unvaccinated people. So whether that means that you will have a serious illness, you may still spread it. That's also flawed because there seems to be a growing number of young people with serious illness. Deaths are not the only sequelae of this virus infection, and there have been a growing number of young people with very incapacitating and serious outcomes from COVID. And we don't know whether the new mutants, which are easier to spread, will actually cause more serious illness from when they become more more widespread. The key way to keep all of that under control, to keep mutants from becoming the predominant circulating virus, and to keep people safe that are that may be immunosuppressed, or your own for your own health, is to just get vaccinated.
That's right. It's great. I mean, the risk of waiting for another vaccine is much greater than the risk of getting the vaccine and then having a vaccine that may be reported to have lower efficacy, but in the end, the results are the same.
That's
Marie,
right.
we're getting some,
As you've
right.
said, effectiveness is really the key. Remember, efficacy with all these vaccines were compared to people who were not vaccinated at all. So, when and if we were able to compare between vaccines, I am very confident, because they all show, as you said, 0 deaths, 0 serious disease, and decreased spread. Any of the vaccines are doing that. It's just a wonderful, wonderful success story.
Absolutely. In fact, it's said in the media a lot, and I wish we'd say it more, that the vaccines have been undersold, that we're underselling them, that the effects of the vaccine are tremendous. And we've started seeing that in places like Israel, where they have a high percentage of the elderly population vaccinated, and now their death rates and hospitalizations are down something greater than 35%, which is remarkable.
Actually 35, 40%. Yeah.
And Marie, we're getting a few questions from Facebook. Just can you comment on what's happened with this sort of up and down of cases in the U.S. and in our region?
We know that if cases are directly linked to mitigation measures of using, being very careful about distancing, not gathering together, decreasing amount of interpersonal connection with people outside of your home group, and not wearing masks. So that has driven the increase in cases, across the country and across the world since the beginning of the pandemic. We have seen ups and downs with this, with different communities that lock down for a certain period of time, or close bars and restaurants, or decrease, or have limitations. But the main driver has always been our own personal behavior of how we mitigate and how safe we keep. The new factor is vaccine that's helped decrease cases around the world. So we know that independent of anything else, vaccinated communities that have a large uptake of vaccine, meaning that many people get vaccinated, have seen a decline in cases, and a decline in deaths, and a decline in serious illness. That's best seen in long-term care facilities, where those small groups that have been vaccinated fully have already shown the benefits of having much decreased illness, severe illness, and death. And it is, it's very gratifying to see what vaccine has done. In Vermont, we have done a really wonderful job of following the guidance about mitigation, of staying separated and masked, and up until recently, where I don't blame people for being very fatigued of what you have to go through to not join with others, and to not, see friends, and to have gatherings. We completely understand that, and everybody feels the same way, me included. And that has translated into some groups that have had outbreaks. There have been obviously school groups, friend groups, mills, and other work situations, and these are another reason why we have to vaccinate as fast as we can and to as many people as we can. And that will bring us back to normal.
Right. The more we can vaccinate, the more these cases will decrease, but more importantly, the more hospitalizations and deaths. A lot of people are asking specifically about Bennington County and the decrease in cases, where just 2 weeks ago there were increasing cases. Our hospital here, Southwestern Vermont Medical Center, had as many as 25 patients. That's about half of the number of inpatients hospitalized with COVID-19. And they're wanting to know the reasons behind those numbers. And I think the response there that you and I have talked about is there's a lot of variability. There's a lot of reasons why there may be a decrease in cases. And as you pointed out, adherence to mitigation measures is a huge reason. People see the cases go up and they start adhering, they start traveling less, and that helps. But there's probably other variables that we just don't identify. And one may simply be that all the people that aren't adhering to mitigation, they actually got the disease. And now that the ones that are adhering are not getting it. That's not the same thing as herd immunity. That's just local small populations and a variability in presentation.
Yeah, we're lucky in our state that almost all of our infections have been in clusters and not in what we call community spread. We were very worried a few weeks ago that community spread was going to take place here to a large degree, as it has in many other parts of the country. And that there's a certain point where that cannot be easily checked by quarantining or isolating a certain group of people. But I'm hopeful that between a lot of vaccination and people become adhering again, understanding what it means to not adhere, that's, and testing those waters, that we're going to bring it back. We're going to keep it back down. And we're very, very lucky that this week we have seen less cases overall, although the state in general has still shown some increase in cases beyond what we would like. There's been definitely less hospitalizations, which is great.
So now that we're in the 70 plus age band, and as we heard from the governor's press conference just the other day, we're going to probably move to that 65 age band really quickly within a matter of weeks. And so that starts to beg the question for these folks that are vaccinated: when can they travel? When can they interact with family they haven't seen in a while? And I just want to comment a little bit on that, because we know that with vaccination, eventually mitigation measures can drop and travel can resume, but not today.
Right. We just aren't there today. I do feel like there should be a shout out to the people in our state that I read yesterday. I guess it was your messaging that 57% of the people that were eligible to sign up in the 70 plus age band signed up in one day.
Unbelievable.
It was just wonderful. So we're really on course. But we're not there yet, in that we cannot just launch into normal behaviors. One is that it's likely that unvaccinated people would also start traveling and not wearing masks and behave as if there was no need for mitigation if the folks that were vaccinated started doing that. Secondly, there is still work being done on whether there is any amount of transmission from a person that's been vaccinated to unvaccinated people. That is being very intently studied, of course. We're very sure that will decrease the amount of transmission, but it may not be zero. And we don't want to start transmitting mutants, the viruses that are more severe and that may not be as well covered by our vaccines. So behaving as if we were not vaccinated for right now is really important. Do we think that things will loosen in time? Absolutely. It won't be long, but they're just asking everybody to understand that it is not, it's not something that's just been done willy-nilly. This is a well thought out strategy to get as many people vaccinated first, and then start relieving those mitigation.
Absolutely. Marie and I talk a lot about the fact that you hear on the media experts saying, we just don't know yet. We just don't know yet. And that is true about some of the specifics. But we do know a lot about pandemics. There have been many over time, and we know a lot about virus behavior. So right now, if we jumped out of those mitigations with just a few percentage of the population vaccinated, the prevalence of the virus is too great out there, and you're going to be bumping into it. So even if you're vaccinated, you're going to be bumping into it so much that your risk is a little high. But once we get a large percentage of the population vaccinated, even with the variants that are coming about, the prevalence of the virus will decrease enough that we can start traveling more, and we can start hugging one another and moving to that. And hopefully that's going to be actually here before we know it, potentially even by the summertime, which would be fantastic.
Yeah,
and I don't think society is going to stand for it much longer.
Right.
Anyway.
Good way to put it, actually. All of that just explanation. Yeah.
That's great. So, when we talk about vaccine right now, it's available through Southern Vermont, Southwestern Vermont Medical Center at Southern Vermont College. There are other drugstores and other places that may be offering the vaccine. It's in the media. Can you just talk about that a little bit?
Yeah, the federal government and the state government have partnered with Walgreens, and I'm sure they're going to partner with other commercial pharmacies to start giving vaccine as part of a very, easy to access walk-in kind of experience. It's not fully done yet in our state. There are some states that are doing it right now. There is I think you still sign up, but we're excited about having partners do with us to do vaccination, so that as many people can get vaccinated as they can, where they're comfortable, where they're local, where it's easy to access. We are planned to and are very capable of uploading our vaccine numbers. We are currently receiving 800 vaccines a week. We are giving over 300 vaccines today. Our center at Southern Vermont College, I'm really proud of. I think the folks that have put it together, and I could take zero part of that, except that I walked around in awe. It is a lovely experience to have your vaccine there. And we've tried to make it as easy as possible for folks to be able to get their vaccine in their community at our center. There's also several others at Bennington Rescue and Bennington College, and maybe I have that wrong. Bennington College and Burton Academy, and there'll be more. And pretty soon, doctors' offices will also be able to give vaccine, we hope, especially when we get more and more types of vaccines that can be easily stored and easily, administered.
Great. Some of the concerns with vaccine are waiting until they're available at other spots. And what would you say in that regard, if you qualify?
I'm sorry, say that again.
I have heard some people say, well, maybe I'll just wait until it comes to my doctor's office.
Yeah. Well, I think our theme has been, that the faster we get vaccinated, the more we decrease the likelihood that we will spread, that we will keep this virus circulating in our community, the less chance that mutant viruses, those more severe strains that are out there, will be able to take hold and be able to be spread more readily. So please think about your opportunity to get your vaccine as the very first, as soon as you can get it. rush to get it because it's good for you, it's good for your family, it's good for the whole community. No reason to wait.
Great. So, different states have approached vaccination a little differently. There were some federal guidelines, but not real strong recommendations, and that has led to some confusion. Was Vermont right to go with an age band approach as opposed to what some states have done, which has sort of opened it up to certain professions
Right.
and longer? What can you say about that?
Well, of course, we do believe that we've done it absolutely right, and I think that will be borne out. We talk about this a lot. The people who suffer the most from this illness, from this virus, are the elderly. They are overrepresented in the number of people with severe disease and deaths. And in fact, the numbers are sobering. More than 25% of all deaths in this country have been, actually 40% of all deaths in this country from coronavirus have been in long-term care facilities. People who are over 75 years old represent 20% of all deaths from coronavirus. So even though there are many people who are front facing, who see the public, who may possibly become infected, the folks that have the worst outcomes are those people who are in advanced age. That's why age bands are really the logical place to be sure that you've covered before you think about doing folks that are of lower age, that that have professions that face the public. There also is a complexity of trying to choose who are the most worthy of the front facing and public facing professions. Is it grocery workers, teachers, bus drivers? Everyone is deserving, of course,
Mhm.
but trying to create who should be prioritized slows down vaccine delivery, whereas age bands is a cutoff that is so easy to get vaccine to the right people as fast as possible. There have been other states that have tried it in other ways, but they are running into those complexities and delays, and it's so unfortunate. I do think that we will be able to, after we get people of older age fully vaccinated, we can then start, honing in on groups if we need to. But luckily for us, the vaccine supply is increasing at such an amazing rate that we should mesh the general public with an increased vaccine supply by the late spring at the very latest, I believe.
No, that's extremely well said, and thank you for clarifying that. We get so many questions on prioritization, and like you said, the questions are coming from groups that have a compelling reason why they need to be vaccinated, and the truth is we just all need to be vaccinated, and we will get there. Let's get those higher age bands vaccinated, and then by then we will have, in summary of what you said, enough vaccine that the question will be pretty moot at that point.
Right.
And then another summary just here as we finish in, we're running out of time. We did want to say from some clarification, if you are vaccinated, it is too early at this point to stop mitigation. You should not travel. You need to abide by the Vermont travel restrictions. We do know that these will be lifted pretty soon, especially for vaccinated folks. Just wait for that to happen. And there's reason behind it. It's not because someone doesn't want you to travel. It's because we want to keep the virus at low rates and drive that down until we get a good percentage of people vaccinated. And hopefully, again, by late spring to early summer is really possible for our population. So thank you for joining us today, Marie, on Medical Matters Weekly. We loved having you. You and I will be talking to the public more. And I'd like to also thank Mike Cutler from CAT TV, Ray Smith from Southwestern Vermont Medical Center, and Ashley Jowett from Southwestern Vermont Medical Center. I'm Trey Dobson. Go out and find joy in everything you do, even in the face of adversity. And we'll see you next week.
Thank you. Get vaccinated.